right, nurses, haha, it is the 30-day NCLEX challenge. Have you studied today? Have you studied today? That is our question. This is day number 11. This is day number 11 of the 30-day NCLEX. Hey, we are all in it. We are studying our virtual trainer study calendar, and look at my calendar. It is looking more and more beat up as I am walking through this program with you guys, doing it every single day. Hey, if you have it, then you are well aware that today we have a lot to study from the NCLEX virtual trainer workbook. What I'm doing is I'm going over the major themes of today's lectures. All right. And also I will be giving you guys questions from Quick Facts from NCLEX, because that is a huge part of our review. So did you make it? I'm so glad you made it to the live video. It is going to be a good one. Whew. Today, it was so much. I found myself having to really study and schedule time out for my kids. They wanted to go swimming. I was like, okay, an hour in the pool and that's it. And so I'm telling you, doing this work is a challenge, but by God's grace, we will get through it, and we will get through it all. If you want to get started with the virtual trainer, listen, this is the time now. Go to my website, remarnurse.com, and get your NCLEX VT, okay? Oh, shout out to Nurse Barbara. I passed. Congratulations. Listen, don't sleep on this. We got a lot of work to do, all right? So, all right, here we go. Are you guys ready to put the questions on the screen? The answers to the questions on the screen. And if you don't know it, it's all right. Make sure that you write down the information. I'll try to just go through the points that I saw today that I didn't want you to miss. So again, we are going over day number 11 in the calendar. The things that we studied today were clinical judgment, activities. Clinical judgment is very important for RNs and PNs. You got to know clinical judgment, diets. And do you see what I did there? I put diets on day 11 as well as day number 9. So you had a second opportunity to do diets. I watched Basic Care and Comfort. I took a break. I took a long break. And then I did Quick Facts pages 31 through 40. And I also did the pharmacology and Quick Facts as well. So here we go, guys. All right. Fred, I passed in July, but still join in with your questions. You're the best instructor ever. Thank you so much, Fred. What I'm doing right now is I am going through the entire VT program with my students. So I hope that they are getting a lot out of it. All right. So the new topic that we introduced was basic care and comfort. And I'm looking at my computer down here to go over the notes. All right. So with basic care and comfort, we were talking about what? We were talking about nutrition. We were talking about hygiene. We were talking about keeping patients in well elimination patterns and what assessments had to be done if something was irregular. And so basic care and comfort will also take us through to orthopedics, which we will be studying for tomorrow. So there's a lot of topics in the general term for basic care and comfort on your NCLEX exam. All right. So the first thing that you were introduced to was the alterations in bowel and bladder. So my first question is this: what is the term anuria? What does the term anuria mean? All right, put that on the screen if you know it. If you're just joining us, we are going over our lesson in the virtual trainer. If you have the virtual trainer, thumbs up to you. You are getting that nice content that is going to help you get your license. If you don't have the virtual trainer and you want to check out what we're all about, today you will be able to do that, and you'll be able to see what it is we're studying. Yes, so you guys are putting it on the screen. It means no urine, but there is actually a number, and that is less than 50 milliliters of urine in 24 hours. So if somebody has less than 50 milliliters of urine, then that is considered anuria, no urine. Okay. All right. Next question is this: should a nurse wear gloves when Let me say that again. Should a nurse wear sterile gloves when removing a fecal impaction? Should a nurse wear sterile gloves when removing a fecal impaction? What do you guys say? What do you guys say? That is something that we went over. Fecal impaction today. It was something that you should have looked up, reviewed. I mentioned it in the lecture. So should a nurse wear sterile gloves when removing a fecal impaction? Good job. I'm so glad you guys showed up. All right, showing up is the hardest part, and then participating. So share this video because we're actually doing questions. And if you know someone who loves NCLEX questions or who really needs this content review, share this video. Nurse Benzo, hi Remar family. I passed my NCLEX. Remar VT is the best. Yes. And as I go through this book, I'm telling you, I have a new appreciation for the information in here and what you guys are doing on a daily basis. All right. So the question was, thank you, Regina, for taking the time out of your busy life to help us prepare and succeed. Yes, yes, yes. Thank you. Many blessings to you as well. Okay. So the correct answer, guys, you picked up on that. No sterile gloves when you're doing a fecal impaction, but the nurse should absolutely wear regular gloves, right? It's universal precautions. Okay, good job. Next question. We know that we should wash skin. We should wash skin that is exposed to urine, but do you dry the skin too? Should you dry the skin or should you let the skin air dry? What do you guys say? All right. Just joining us, go ahead, put your answers, your comments on the screen, and smash that share button. This is day number 11. This is day number 11 of the 30-day NCLEX challenge. And I'm asking you guys from the Quick Facts book and the student workbook. We know that skin that is exposed to urine should be washed, but should we dry it or should we allow it to air dry? What do you guys think? I knew I would get you. I knew I would get you. And I was studying hard this information today. The correct answer is we should dry the skin. We should dry the skin. We should not let it air dry because the longer that a wet substance is on the skin, the more likely it is to what? The more likely it is to, you know what it is. It is to break down. All right. So we should dry that skin. You wash it and you dry it. And you see how tricky NCLEX can be? Do you see how it can present to you guys half-truths? Half-truths. And if you are not strong in your word, come on, I'm about to preach something. If you're not strong in your content, you will fall for the distractors. You will fall for those distractors. All right. So we should definitely dry the skin. Okay. Next question. What does bladder training mean? If we say we have a patient with multiple sclerosis or spinal cord injury and we are bladder training them, what does that mean when you bladder train somebody? Okay. Okay. Don't get me started today, guys. Y'all are acting out today. It is the end of a very long day of studying NCLEX. So I'm just coming to you guys as before you move on to something else. Hey, we have to definitely go over this. So bladder training can also be called scheduled voiding. So that means that the patient is urinating at the same time on time intervals. Yes, it is to help them to toilet, strengthen the bladder, all those good things. I love it. Yes, bladder training. Shout out to the nurses that are passing, coming on, letting us know that with God, it is possible. And with consistency, it is possible. This whole 30 days is not about perfection. I don't care if you guys are getting it wrong. All right. It's about progress, not perfection, progress. All right. All right. Thank you, Regina, for doing this for us. I'm an LPN trying several times for my RN license. Unfortunately, I haven't made it yet. Hopefully next time I will after I complete the virtual trainer. I'm with you. That's my prayer as well. All right. We're doing this as an investment in ourselves. All right. Urine scheduling. Yes, you guys got that. I'm moving on. We understand that concept. The next question is, is the urethra considered, Upper urinary tract or lower urinary tract? What do you think? Is the urethra considered upper urinary tract or lower urinary tract? All right. Hey, all right. I have all these nurses coming on today telling me that they passed their NCLEX. Connie B. Hey, Regina, just wanted to say thank you so much. I took my test on Tuesday. Oh, and passed. All right. Much love. Awesome. Congratulations. Hey, Connie, do me a favor. I want you to have the Remar nurse shirt. So please go to the website remarnurse.com /party so you can get that Remar nurse shirt for me. All right. And there'll be the instructions of how you do that. Yeah. All right. I see all these answers. Upper or lower, upper or lower. The correct answer is the urethra. Think about the function of the urethra and then think about where it's located. Okay. The urethra is considered a lower. Yes, lower. Yes. Don't get it mixed up with the ureters. All right. Yes. All right. I'm moving on, guys. The next question is this. Oh, I wanted to tell you guys, yes, the it's considered lower. Also have in my notes that the prostate and the bladder are as well considered lower, and NCLEX likes to ask about that, the prostate and the bladder as well. Okay. Next question: do urinary tract infections increase or decrease with age? What do you know about that? Are we expecting urinary tract infections to increase or decrease with age? Yeah, just think about what we talked about. What day was it? It was day number 9 that we talked about expected changes in aging. And we went over every body system and we talked about the normal things that are expected to happen. So yes, I see the answers. They are correct on the screen. Good job. Good job. We expect urinary tract infections to increase. A couple of reasons why. Think about why urinary tract infections will increase. I'm going to name some. If you have some other than the ones I named, put them on the screen so that I can see the comments and then everybody else can see the comments too. So yes, urinary tract infections increase because the elderly typically are drinking less, so they're dehydrated, and also they have urinary retention. All right, and so retained urine can sometimes grow bacteria. I know I'm gonna get what are another reasons? Polypharmacy. Somebody said low immune system as they age, dehydration, their bladder size decreases. Okay. Decreased muscle tone. Very good. I love that answer. And so these are reasons why that will increase the propensity for urinary tract infections. Great job. Weak bladder. Awesome. All right. So I hope this is motivating you guys. I hope this is stimulating your mind, and also letting you know that you can do this. You can understand this information. All right. The next thing that I have here is switching subjects. Apical pulse. We know what an apical pulse is. I'm looking for 2 age groups, not age groups. Let me say 2 types of patients. One is the age group that requires an apical pulse. One is the age group. The other answer I'm looking for is a type of patient. What's the answer? Who needs an apical pulse? Give me the age group and then give me the type of patient. It's a basic question. I expect you guys to get it. All right. I want to make sure I don't miss any question that I have for you guys. Older and infant. Okay, older and infant. So heart patient and young, neonates, peds. Okay, good. Those are what I was looking for. I asked the question, what 2 types of patients need apical pulses? So remember, we always do them for infants. They get the apical pulse always. And then also for our cardiac patients or those with irregular heart rhythms. All right. Just because a person is elderly, that doesn't necessarily mean that they get an apical pulse, but if they have cardiac problems or abnormal cardiac history, then we would do the apical pulse on them. All right. I like that. Is there another one that I missed? Of course, patients taking Digoxin Yes. Yep. Patients taking digoxin, any cardiac medications. I think it would be your due diligence to do an apical pulse. All right. Good job. Next question is this. During a 24-hour urine collection, should the patient increase their fluid intake? What do you guys think about that? During a 24-hour urine collection, this was the topic that we went over. All right. Should a patient increase their urine in not their urine intake? Should a patient increase their fluid intake? I was when I was looking at the scale today, I said, okay, I gave them this information. Let's see how they apply it. What do you guys think? And just think about the reason why they should or shouldn't. Okay. So I see a lot of people saying yes. I see some people saying no. I see people saying big yeses, big no's. But isn't it good to like be put to the test on this? During a 24-hour urine collection, think about what you're trying to see, right? Think about what you're trying to see and why a doctor would order the 24-hour urine collection. All right. Ask yourself that question when you're studying. Why would I do a 24-hour urine collection? What is the doctor looking for, right? Not only do you have to know the steps, because the steps you have to know because you teach them, but also understand that during a 24-hour urine collection, it's your responsibility to teach the patient to drink normally, to drink as they would, because you're trying to see what's currently in the urine, what's currently hanging out in the urine. And of course, if your patient has increased fluid intake, then that's going to flush out a lot of what's normally there, and you won't get a true reading of what your patient's urine will look like, right? So if I'm drinking a whole 2 gallons of water, in a 24-hour period, my results are going to come back skewed. And so we would teach our patients to drink normally. All right. Next question. If a patient is doing a 24-hour urine collection, is alcohol okay to drink? All right. Think about patients, and remember, you have all type of patients that come into the hospital, right? You have some patients that are actually alcoholics, right? You have some patients that drink. They say they drink a beer every day or 2 beers every day. So during the 24-hour urine collection, is alcohol okay to drink during that time? What do you guys say? No alcohol, no alcohol. No alcohol? Alcohol is never okay. Is it nice? Is there any reason we would allow a patient to drink alcohol? I can think of one. And so the correct answer is no alcohol during the 24-hour urine collection, right? And normally I like that principle. Alcohol is never okay. And I think that's typically true. And for NCLEX is certainly true. But in the real world, remember that patients who are truly addicted to alcohol, if they are experiencing withdrawals and they're not in a medical setting, they are not in a hospital setting, it is life-threatening for them to go through withdrawals, especially with delirium tremors. That can kill somebody, right? And so we go over delirium tremors, but if you are in the field and you're not in a hospital setting and the patient is having withdrawals, then you give them alcohol, right? Then you give them alcohol. Some of you guys know that, right? Yeah, that is true. Okay. Getting a lot of good stuff tonight. I love it. These are very short, intensive study sessions. All right. Okay. Next question. Oh, I just want to make this point because there are certain medications that you cannot have with a 24-hour urine. So write this down in your workbook. Okay, so the medications you cannot have are acetaminophen. All right, can't have acetaminophen or antihistamines or aspirin, caffeine, or vitamin B. So you don't want to give those during a 24-hour urine collection. I'm going to say that again. I'm going to say those medications again. They are acetaminophen. They are antihistamines. They are aspirin, caffeine, and vitamin B. Okay? Don't ask me why. You can't give those during a 24-hour urine collection. What do I want you to do? I want you to look them up, okay? All right. Which isolation precaution is used for handling normal stool? Which isolation precaution is used for handling normal stool? We talked about collecting a urine sample. What about a stool sample? What about a stool sample? Which isolation precaution is that going to be? Yes, good job. Good job. Not fooling you guys there. You're going to use universal or standard precautions when handling normal stool. Remember, never pick contact precautions unless that stool has some sort of bacteria or infectious process going on, like C. diff. Okay, yeah, C. diff. The VRE can have that, and the stool can have E. coli, things like that. Okay, all right. Next question is, question: what topic did we study from today that decompresses the spinal canal? What topic did we study today is used to decompress the spinal canal or spinal column? Does anybody know what it is? It's something that we went over today that is used to fix a spinal cord problem. I'm looking for it. Who's the first person that's going to put it up? And then I gotta go on. Not lumbar puncture. Close. Amy, you got it. Laminectomy. Yes, laminectomy. Make sure you're reviewing. There's very few points on laminectomy, but you have to know like the purpose and how to treat the patient after. All right, so not lumbar puncture. Lumbar puncture is used more for a diagnostic procedure, right? So with lumbar puncture, we're pulling what? We're pulling spinal column fluid. So that's not gonna fix an issue, but the laminectomy is a surgery. You are studying with the #1 NCLEX instructor on the planet. All right. Often imitated, never duplicated, never duplicated. I'm doing 30 days of NCLEX with you every day. We are in the trenches with this NCLEX information. We're knee deep. We're knee deep in it. Well, this is actually not my knee. We're shoulder deep in it. Okay. Next question is this. What are the signs of lead poisoning? What are the signs of lead poisoning? Lead poisoning, lead is a mineral. People not as much are getting lead poisoning, but because the ramifications of it are so severe, it is important for you to know the signs and symptoms of a pediatric client who could possibly have lead poisoning, because people are not getting lead poisoning in factories anymore. All right. It used to be a big problem, but not so much anymore. So the pediatric population still, because they like to ingest if they're in an old house and they like to ingest paint chips, they can get lead poisoning. All right. And the signs and symptoms, you guys got them. Headache, abdominal pain, lethargy, right? Kids get encephalopathy, leads to mental retardation. Excellent. So make sure you know those signs and symptoms, which you guys got, and also the treatment. Good job. I'm moving on. What type of fluid is lactated ringer? What type of fluid is a lactated ringer? This is day number 11. We studied a lot. We studied so much stuff today that I almost did not think that I was going to get it all done. All right. And man, am I looking forward to the rest days on the calendar day. So I might have to get off this live and start studying for tomorrow. Okay. Yes, lactated ringer is an isotonic. It is an isotonic solution. And we're going to settle here with isotonic solutions. Are we? Yes, we're going to settle here for these intravenous therapies because they're very important to know. IV fluid is a medication. All right. IV fluid is considered a medication. And so if you read through it and then when you do the lectures with me, I want you to be able to press down to a different level when you're asked about it. Okay. So you guys know that's fine. Isotonic lactated ringer. Okay. How about this? Which IV fluid is better for nutrition? I'm going to give you two choices because you guys can get it down to two and then you struggle picking the right one, right? So which IV fluid is better for nutrition? Is it hypotonic or hypertonic solution? Say that again. Which IV solution is better for nutrition? Is it hypotonic or hypertonic solution? Okay. You got to use those two choices. Those are the two choices that I gave you. Don't put up anything else. Is it hypotonic or hypertonic? Okay. And think about why. Think about why it would be better for nutrition if a patient's body is starving and you're hanging IV fluids. You better know why. You better know why. Okay. All right. Because the doctors will be giving you the side eye like I just did. New nurse. All right. And so we're not going to have those embarrassing situations because we know our content and we're going to be confident, licensed nurses. All right. Remar nurses, we don't play around with information. All right. So, okay, I see a division, but I see the division numbers slightly skewed towards hypertonic. And if you said hypertonic, ding, 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 you got it. Okay, you got it. So, and the reason why I like the rationales that I'm seeing, good job. The hypertonic solutions do contain more solutes than the regular plasma, right? The regular fluid. So even if you're just guessing, good job. All right. But the reason why is because the more particles that are in the hypertonic solution actually contain what? They contain sugar. They contain glucose. And what do cells thrive off of? What do they love to be an energy source? They love sugar. Okay. They love sugar because sugar is easy to break down and sugar burns very quickly. And so I put this on my Facebook page one day. I said, sometimes, after we eat, within a few hours, we feel hungry again. We're not really hungry. Most of us are not ever really hungry, but what our cells are wanting is more sugar. Our cells want more sugar when it all runs up, because if they don't have sugar, then what happens? Tell me what happens. Incorporate this diabetes mellitus into this IV fluid section. This is how you do it. You go seamlessly from topic to topic. So tell me why our body cries out for sugar. Because if there's no sugar, then the body has to burn what? Somebody tell me. All right. And this is how I'm talking about a comprehensive review. When you're studying, you should be able to go from one point to another point without missing a beat, because that's how your NCLEX is going to be. Your NCLEX is not going to say, okay, now it's time for cardiac. Let me give you 10 cardiac questions. All right. Pediatrics time. Not at all. All right. Not at all. You need to be able to go from A to M to O to D back to Z. All right. And absolutely, yes, the body, if there's no sugar present, then the body has to say, okay, now I got to start burning this fat. And the body's grumpy because the fat is like, it takes more work to break down fat, right? And so that's how ketones are formed. It's like, it's a big production when you have to actually burn fat. All right, for the body. And the cells are, they just they want to do the minimum. They're like most of us. We just want to do the minimum, right? And so that's why fat is harder to lose. That is why fat is harder to lose. It's harder to burn because the cells, they just want the sugar. And we give them the sugar because the stuff that we eat is glucose, right? So it's easy. All right. All right. So are you confused? Are we on the same page? Are we on the same page? Because our initial intent for the IV solutions was which was better for nutrition, hypo or hyper. And so hypertonic solutions are going to be better for nutrition because they contain more sugar, more glucose. And so the cells, if you give it hypertonic solution, it can use that for energy. It can use that for energy. All right. All right. Thank you guys. All right. Thank you guys for studying with me. I don't want to be here alone doing this. Hope you guys got it. Are you with me? I got to move on. Okay. I got to move on. Okay. So we are talking about the hypertonic solutions. What type of solution is D5 normal saline? What type of solution is D5 normal saline? All right. And everybody go ahead and put it up on the screen. I'm not even going to look because I know you guys got it as I work on my next question. All right. Okay. What type of, okay. All right. What type of solution is D5 normal saline? D5 normal saline. No, what? D5 normal saline is hypertonic solution. All right. Because it has that, what is it? What does it have in it? That dextrose. All right. And remember, dextrose, sugar. So think about that for hypertonic. And now you guys know why. You guys know why it's a hypertonic solution. All right. Okay. I have gotten the ticker. These study sessions are supposed to be short, intensive study sessions. And so I got to go now. Okay. So hypertonic solutions. Let's move on to my next question. What medication class blocks epinephrine and norepinephrine from binding to the beta receptor sites? What medication blocks epinephrine and norepinephrine from binding to the receptor sites? What do you guys say? Come on with it. We are studying. But even when the study session is over, what I'm going to do and what you should do is get back into your virtual trainer, and that is where you will continue. And so that is how this works. All right. Good job. The answer was beta blockers. Beta blockers. Absolutely. I thought I could fool you guys. You have to know the indication for beta blockers. All right. Now, the next question is this. Beta blockers cannot be taken with what type of over-the-counter medication? Tell me that. What type of over-the-counter medication should you not take with beta blockers? Come on with it. Come on. Yes. Good job. Good job. I see a couple people that got it right away. Over-the-counter cold medications. Over-the-counter cold medications. Now, the answer is, do you know why? Do you know why you should not take over-the-counter cold medications with your beta blocker? Over-the-counter cold medications have aluminum in them. All right. Okay. Getting down to the nitty-gritty. I love these pop-up study sessions. You guys don't know how much I love it. Like, honestly, I could probably go until 2 or 3 or 4 in the morning just talking about NCLEX stuff. But I won't do that to y'all today. All right. Next question is this. Oh, what is the warning sign of digoxin toxicity in infants? All right. What is the warning sign of digoxin toxicity in infants? What do you guys know about that? Come on, give it to me. We had a lot to study today. Again, between the basic care and comfort and the quick facts and then the clinical judgments, I went through all of that today. The correct answer for what sign in infants is a signal of digoxin toxicity. Remember that you can give digoxin to any age group. You can give it to newborns all the way up until our geriatric patients. And so with adult patients, we know digoxin toxicity, the number one sign, they'll say they have yellow halos, nausea, vomiting, abdominal pain. But an infant can't tell you if they're having yellow halos, but you will see bradycardia in the infant. Infants' heart rates are usually pretty high, right? So you will see that bradycardia for the infant. Okay, guys, I'm gonna wrap this up right now. That was day number 11. Whew, we went over 30 minutes today, guys. That means that there's so much to cover. And I'm just hopeful that you guys are doing the work and you're catching these major themes, because everything that I review for you guys is in the test plan. All right. I'm not having you study extraneous things. And that's why the 30-day challenge hits so hard. All right. I would suggest getting the new Quick Facts if you have the original, just because the new Quick Facts has the updated pharmacology in it, as well as the clinical skills and more topics in the front of the book. And so you are responsible for that information for the test plan. Absolutely. You have to know it. All right. Also, if you need to get your virtual trainer, hop in there so that even after these study sessions are over, you have 90 days in the virtual trainer. So after our 30-day challenge is over, you still need to do the work. Okay. So I am hopeful that you guys are also doing that. Now, for 8 to do, you need to watch the orthopedics. I love the orthopedics video. I think it is one of the sweetest ones in the VT. So watch that one. You have homework, the basic care and comfort homework and progress exam. So we went over basic care today. The questions are tomorrow, unless you decide to cheat and do them now. And then medication administration, super easy video, antibiotics, pharmacology, and then quick facts. Okay, so we have to do quick facts again, page 41 through 50. Do them, hacelo, and then diuretics in the pharmacology section. So that's going to be fun as well, right? And so this is all about progress, not perfection. And I will probably be coming on because I have to study all these things. I'm just right where you guys are. I'm not even ahead of you guys. All right. I'm doing them as the day requires, just so I can really get a feel of what it's like to be you. All right. So thank you guys so much for studying. We have completed day number 11. Pow! We did it. It's in the books. Woo! Getting our nursing license is a struggle. But if we push through every little day, every day, if you just show up and you just do what the calendar says. And remember, you can find the calendar in the file vault. If you don't have it, go there now. Just go there and download week 2. We're going to be on week 3. This has been truly eye-opening for me. And I'm loving this. So join me in this challenge. I want to be here with you step by step. All right. So have a good day, you guys. All right. Again, my name is Regina Callion, MSN RN, here with Remar Review. In Remar Nurses, we believe that you can, you will, you must passing.
Hey everyone, my name is Fatumata. I am from West Africa, and I am a Remar nurse. I just passed my NCLEX. Yay! I am so happy and so excited. I am a repeat test taker. I used all the other products before, and I was just doing questions, and I thought I was ready, but I did it the first time and I failed. And I was just like, okay, I'm doing something wrong here. So I tried Remar. I tried their NCLEX virtual trainer and also Quick Facts. So have those two. These are gonna save your life. And passing NCLEX is like, I call it the NCLEX monster. It's the NCLEX is the monster, but we can crush it, okay? If I can do it, everybody can do it, okay? Like I said, international nurse. Yes, I'm finally a registered nurse. I got my BSN, and I'm totally gonna go for my master's. So thank you, Remar. Thank you, Mark. Thank you, Regina. Thank you for all the prayers that got me through it. And I am so glad that this program exists. So, all right. So, Happy New Year.
The virtual trainer is the best training system for nursing students who need to pass the exam. My name is Regina Callion, MSN RN, and I have helped thousands of nursing students pass the NCLEX exam with my program. You're gonna love it. With my NCLEX review, I'm going to give you all of my nursing content in one place. Not only that, I'm going to make sure that after every individual lesson, you know what is most important. And if you need questions to help you, I have the questions right here. So what I'm going to do is I'm going to give you an amazing opportunity to get in the virtual trainer. I'm also going to send you the virtual trainer student workbook, as well as my quick facts for NCLEX. This is it. This is the opportunity that you've been waiting for. Click the link below. This is the #1 training system for nursing students who need to pass NCLEX. Don't miss out on this opportunity. Click the link below. Hey, what are you waiting for? I want to see you on the inside. This is the opportunity. You don't want to miss it. If your nursing license is important to you, you will take action right now. Let's click the link. Let's go.